This is Sandy Tankus for TOS50.com, the other side of 50. And I'm here today with Dr. Leipziger, who's the chief of the Division of Plastic Surgery at North Shore Hospital, Long Island Jewish Medical Center. And actually, Dr. Leipziger has spoken to us previously about surgical procedures to enhance our appearance. And today we're going to be speaking to him about non-surgical enhancements to help us look younger and better, or to improve our appearance. And good morning, Dr. Leipziger.
Good morning, Sandy. Thank you so much for having me.
Everyone talks about Botox to help get rid of wrinkles. What is Botox and what does it do?
Well, Botox, or the botulinum toxin, is a medication that relaxes muscles. So placed correctly, it would relax muscles in the face to thereby improve facial lines and wrinkles. Most commonly, it's been used in the upper face for the frown lines, the forehead lines, around the crow's feet. It's also used occasionally in the lower face for neck bands or to help improve smile.
Is there any danger to using Botox?
Well, done correctly and used appropriately, Botox has been proven to be safe and effective.
Is Botox the only choice we have to sort of de-wrinkle our face?
Well, Botox is just one of a myriad of minimally invasive treatments that you can use. So the most important thing is, if you're evaluating a patient, you have to understand what the problems are to improve the problems. So there are procedures like injecting Botox, which relaxes the muscle. There are also fillers to fill valleys on the face and fill lines on the face to make someone look more enhanced. We can evaluate a patient based upon their desires and then try to give them a realistic evaluation if these non-surgical or minimally invasive procedures can help them. It's important to remember that all of these injections are not a facelift in a syringe, and they do have some limitations, but done for the right reasons with appropriate expectations, they tend to work quite well.
You mentioned fillers. What exactly is a filler?
Fillers are medications that can be placed into valleys or wrinkles of the skin. There are a multitude of fillers, but the most common ones used in our armamentarium are Juvederm or Restylane. So what those are actually hyaluronic acid. Hyaluronic acid is actually a component of your skin. So what we're actually doing is we're actually placing one of the components of your skin back into your skin to fill that valley or wrinkle. Done for the right reasons and the right patients, that actually works quite well.
Are there other procedures that we can do to keep ourselves looking younger?
Well, I tell everybody that the one thing anybody can do, regardless of their age, is good skin care. So simply taking care of your skin, moisturizers, sunblock, perhaps seeing an esthetician to take care of your skin, developing a home care regimen, a program, simply doing that over a long period of time will keep your skin looking more vibrant and less wrinkled.
And if you were having these procedures done, how often do you have to have them redone?
Well, it's important if you're to have a program with any of these types of procedures. So if you're having skin care, you would be under the guidance of an esthetician, and that person would guide you in terms of how often facials would be required and to evaluate your home program and modify it as necessary. If you're having injectables such as Botox or fillers, then the plastic surgeon would evaluate your face and tell you how often to repeat the procedures to have the longest lasting result. As an example, Botox patients tend to come in 3 times a year for Botox. Filler patients can come in twice a year for filler.
Thank you very much for speaking with us today, Dr. Leipziger, and giving us all this information on how to keep ourselves looking younger.
It's certainly a pleasure. Thank you so much, Sandy.